Hi, today I want to talk about one of my favorite plants, willow bark. I have an incredible relationship with willow bark. I've used it for over 20 years. I've prescribed it to my patients with excellent results. And willow bark is known as nature's aspirin, but it is very, very different from that little white pill that you buy at the gas station or at the drugstore. Very different. And the difference really is that willow bark has all these other components, right? Flavonoids, polyphenols, tannins, all these natural components of the plant. That's what makes all the difference in the world. And we're going to get into that. I want to discuss the molecular structure of willow bark versus aspirin. I want to give you some history on willow bark, and I want to talk about the clinical significance, right? The pathways of how it works in our body and how it can benefit you if you're on a journey of wellness, longevity. Then willow bark is certainly a plant that you want to investigate. So if you're interested in this, come with me in the next 10 minutes, and we're going to dive into willow bark. It's been around for thousands of years. In the old Egyptian records that we have records of willow bark being used to reduce pain. The Greeks, Hippocrates, in his notes, he talks about how you can chew the bark of willow bark, and just by chewing, you can reduce fever. And then in about the 19th century, scientists took willow bark and they isolated salicin from willow bark. And that salicin is a component they developed into acetyl salicylic acid, otherwise known as today's aspirin. And it is effective, right? There's no question that aspirin is effective. It works. But aspirin is just one isolated molecule from willow bark. And when you isolate a component of plant medicine and concentrate it, then you end up getting side effects because it's not the way that nature intended that plant to be presented in a medicinal form. And as I mentioned, when we have willow bark, we have all these other components, right? And when we compare willow bark to aspirin, we don't get the same effects in the body. And most importantly, we don't get those adverse reactions that we get with aspirin. So we know that aspirin can irritate the stomach lining, right? I've had patients that have taken so much aspirin that they've literally burned a hole in the lining of their stomach and created these ulcerations and bleeding. I have patients that are taking blood thinners and they can't take aspirin because it affects the platelets in such a negative way and it causes the blood to become too thin. So we know that aspirin has its place, but it's not the same as willow bark. Willow bark does not cause those adverse effects, which is amazing, right? When you take the plant in its natural state, it gives us what the plant was intended for. All these wonderful positive effects, right? Without the negativity. Which brings us to the pathways. So how does willow bark work in our body? So it affects a pathway, first of all, called the COX-2 pathway. And it inhibits the COX-2 pathway. This is essentially an inflammatory pathway, okay? And it involves something called prostaglandins. The willow bark inhibits that. So we reduce inflammation. And as you know, inflammation, although it's our friend, very often in disease and injury can get out of control, right? It can go rapid in our bodies. Our immune system can become unregulated, create too much inflammation, and start even destroying healthy tissue. So willow bark inhibits that COX-2 pathway. It reduces pain and inflammation, gives us some very good relief. Another thing that willow bark does is it influences something known as the cytokine signaling pathway. And this is a pro-inflammatory pathway. These are markers such as TNF-alpha, interleukin-6, and these are essentially the foundation of pain and inflammation in the body. When you take willow bark, not only does it have a tendency to regulate those markers, okay, but over time, it helps your body basically strengthen. So your pain threshold over time will increase. And your body's reaction to inflammation will also change so that you will be more tolerant to injury, more tolerant to painful stimulation, right? It works with the body and it addresses that underlying process. It doesn't just mask pain. Amazing. As I mentioned, also has a milder effect on platelets. So if you're taking blood thinning medication, a lot of times you can take willow bark along with it. However, disclaimer, if you're taking any kind of prescription drug, then get cleared by your doctor, obviously. I'm not your doctor, so just passing the information on to you. But in my personal experience with patients over the 20 years that I've been doing this, I can give willow bark to a lot of those patients that are taking prescription drugs without any adverse reactions. And it's a big deal because those patients have had good effects by taking, for example, Advil, but then they're told don't take Advil because that NSAID can cause stomach bleeding and things like that. A lot of those patients are able to get the benefits from willow bark, which is exciting. And finally, one of the things that willow bark does, I mentioned there's flavonoids. Those flavonoids act as antioxidants. And so if we think about the process of inflammation, the process of healing, we use those inflammation pathways, right? And we create from those inflammation pathways a lot of damage. And there's a lot of free radicals that get formed from the process of trying to heal the body. Willow bark has these flavonoids. They're antioxidants. They essentially go in and mop up these free radicals. They clean up after, which is incredible. It's a self-contained plant that goes in and takes care of the entire process of healing, which we don't get that when we isolate just the salicin component of willow bark. And by the way, as we're speaking about this stuff is not just theory. There is a lot of good research on this. I mentioned to you about the difference between aspirin and willow bark. And there was a study done, I'm going to put it up on the screen, and what they did was they compared side effects. And they found that patients that were taking aspirin versus patients taking willow bark, the willow bark patients never got that irritation to the gastrointestinal tract. And the researchers were puzzled, right? Because they assumed that it was all about the salicin. And they thought, well, if the person is taking aspirin and getting the salicin, and they're getting pain relief, but their guts are being irritated, and they compared it to the people taking the willow bark. And they noticed that the amount of salicin in the willow bark patients was a lot lower than the aspirin. But yet the willow bark patients were still getting the same amount of pain relief without the irritation to the gut lining. And of course, the scientists were like, well, how can this be? And they were forced. And I say forced. And I use that word forced because I believe they were forced because they didn't want to have this conclusion. They were forced to acknowledge that it has to be due to the other components found in the willow bark other than the salicin that was leading to the results without the adverse conditions. Very interesting. Another good study was done on about 200 patients where the goal was to see if they could get these patients off of tramadol, which is a very strong prescription drug for pain relief. In that case, they had results in just the first week, where some of the patients in the first week were able to get off of tramadol by taking willow bark. At the end of the study, in 4 weeks, a significant amount of patients were able to get completely off of tramadol by just using the plant willow bark. Very exciting. And finally, we had a meta-analysis, and the meta-analysis was on arthritis pain, and willow bark compared to a placebo. Willow bark won. Patients found that by taking willow bark, they had less pain, and here's an important factor, more function. They were moving better, they were feeling better, and they reported less pain taking willow bark versus placebo. So I hope this inspires you to consider willow bark, one of my favorite plants. I've used it for a long time. I find its results are very effective in patients. Most people will find improvement in like the first 10 to 20 minutes of even taking it. And you can take 1, 2, you can take 3 of these tablets a couple of times a day if needed, and really use it as a way to regulate and train your system with inflammation and pain. Now, you can go to Walmart after you watch this video, or Amazon, like everybody does, right? You can purchase willow bark for like $6 or $8 a bottle, and you'll get it and you'll use it and you'll be like, hey, this works pretty good. And the reason it works pretty good at that low price point is because it's aspirin. What a lot of these supplement companies do is they take aspirin, essentially, and market it as willow bark, the natural product, right? But when you analyze their product, there are none of these polyphenols, none of these tannins, none of these components, right, that we talked about, like the flavonoids, that make the plant do what it's meant to do. Instead, you're essentially just taking overpriced aspirin. And we don't want that. So if you want to try willow bark, you have to take the proper extract. The very best extract of willow bark that I've found in 20 odd years of being in practice is standard process. It's called Salagesic. It's not cheap. It's very expensive. It is very good. And I would encourage you to purchase a bottle of Salagesic. I'll put the links in the description of the video. Purchase a bottle of Salagesic. Do a cycle, right? Take a bottle of it. See how it makes you feel. I have not had anybody that does not report. Nobody. Just think of this. In 20-something years of practice, I have never had a single patient tell me that they did not enjoy the benefits of Salagesic. That's incredible. So maybe you'll be the very first person. I don't think so, though. But try it. Try the willow bark if you're suffering. Who's it for? Anybody. Anybody suffering from chronic inflammatory conditions, acute conditions. Like I said, I have a good relationship with willow bark. If I work out on the treadmill afterwards, if I'm a little sore, I'll take some willow bark to remind my system, okay, guys, we've done a little damage, and that's okay, but remember how we want to process that. We want to have the anti-inflammatory effect, but we also want the antioxidants. We want to train the system to be more resilient. So I'll take a Salagesic tablet after I have that hard workout. Of course, if I injure myself, which I'm always doing because I'm very active and I'm very silly, if I do too much activity or something and I have an injury, I'll take Salagesic for a day or two to help that injury resolve. Thank you for watching. Please subscribe to the channel. Give a thumbs up. Let me know in the comments what you think of it. I'll see you again in a few days. Bye-bye.